Hey guys, Dr. Washburn here, and today we have a different patient to take a look at. We have Dr. Chris Marker here, who unfortunately injured his right knee with some pickup football recently. Dr. Marker, how did this actually happen?
Well, it's pure ego driven. You see a 13-year-old nephew playing football on the street with his friends and you figure, I'm just going to jump right in and try to guard one of these guys. So it wasn't any specific twisting or anything where I really felt pain at the time, but the next day I started to have pain on the inside of my knee.
Okay, all right. Well, I'm just going to check out his knee real quickly here. With any sort of pain along the inside of the knee, it could be a number of things. First off, just trying to figure out exactly where it is tender. Would you say it's kind of right down here or more up in this area?
For the first one.
Right there. So if I bend his knee, you kind of feel it around there. Still down in this area?
Yes, and a little higher.
Yeah. So and this is his joint line right here. But if we just check his basic range of motion, he's still got good range of motion. That all feels okay?
Yeah, at the end of flexion there, it hurt a little bit.
Okay. But he doesn't have any gross instability at the knee or anything like that. I'm taking a look at him from the opposite side because I've got the ultrasound machine over here. So, but how's this feel?
I'm okay with that.
That all feels okay? Okay, all right. All right, well, what we want to do is just take a quick look at it under ultrasound and see if we see anything today. So we're going to go ahead and do that right now. His pain is kind of right there at the medial joint line and just a little south of that. So of course we would always be concerned about a meniscus injury. There's also the medial collateral ligament in that area. And we also have some hamstring tendons as well that we'd have to keep in mind. So take a look right here under ultrasound. There's his joint line. That's his MCL, medial collateral ligament, going right over the meniscus, which is right here. Dr. Marker, would you say this is where your pain is, or does it feel like it's a little further south?
I'd say right about there and a little south.
Okay. So if we kind of look at this area both towards the front and towards the back, one can make the argument that there might be just a little bit of fluid collection right here underneath the MCL, but really not much. If anything, there might be also some on the top side as well. But if we come all the way down, take a look at that MCL, everything looks fine there. And if we look posteriorly, so do a lot of the tendons. So, you know, at this point, it probably is some degree of an MCL sprain at the very least. There could have been some medial meniscus involvement, but it seems like the pain is not exactly at the joint line. So I say this is probably what we do at this point is we continue to watch it for the next couple of weeks. He's gonna start to do some exercises with our physical therapist, ice it, rest it, and we'll check back in a couple of weeks and see how we're doing. How's that sound?
Sounds good, Doc.
Perfect. All right. We'll check in with you guys later.